If you think human anesthesia is complicated, wait until you find out what veterinary anesthesiologists have to deal with. In my world, if somebody tells me their patient weighs 70 kilos, has one heart, 2 lungs, and can follow instructions relatively well, I already have a pretty good idea of what I'm working with. But a veterinary anesthesiologist might anesthetize a chihuahua in the morning, a Burmese python at lunch, and then finish off the day helping load a tiger into a CT scanner. We all have the same goals, just wildly different patients. Today we're diving into the fascinating world of veterinary anesthesia, from our furry household companions all the way to some of the most exotic creatures on Earth. For a person who provides anesthesia for a living, the core goals are exactly the same, whether your patient is a hamster, a hippo, or a human. You want unconsciousness, you want pain control, and you want muscle relaxation when necessary. But above all, you want to maintain the ABCs of physiology while the procedure takes place. Airway, breathing, circulation. The basics never change. But animals bring one enormous challenge that human anesthesiologists usually don't face. And that is that the patient can't tell you anything, at least not with words. Your cat can't tell you that their IV hurts. Your parrot can't tell you that it feels dizzy. Okay, well maybe a parrot could, but your snake definitely can't tell you that it's becoming hypothermic. Veterinarians have to rely entirely on physiology, behavior, and monitoring equipment to understand what their patients are experiencing. And because every species evolved somewhat differently, every species plays by slightly different rules. Let's start with the classics. Dogs and cats account for most veterinary anesthetics, and in a lot of ways they're surprisingly similar to humans. They get IV catheters, they receive induction agents, they get intubated, they receive inhaled anesthetics like nitrous oxide or sevoflurane, and they're monitored with EKGs, pulse oximetry, and blood pressure measurements. But even our beloved pets come with some unique challenges. Dogs with short, flattened skulls like bulldogs and pugs are basically the difficult airway patients of the veterinary world. Their compressed anatomy creates a very high risk for airway obstruction, which makes removing the breathing tube while they're still not quite fully conscious a pretty nerve-wracking moment. Meanwhile, cats often become tiny chaos goblins with some very strong opinions about veterinary visits. But they also have airways that are much smaller and more delicate than dogs, which means intubation requires a lot more care. And because animals hide signs of illness incredibly well, sometimes the first clue that something is wrong appears during the anesthetic itself. So even with common household pets, veterinary anesthesia demands extreme vigilance. Now let's talk about birds because they're absolutely wild from an anesthetic perspective. Their respiratory systems are completely different from ours. Instead of lungs that expand and contract, pushing and pulling air in opposite directions, birds have a system of air sacs that create one-way airflow through their lungs. That means oxygen exchange in birds is incredibly efficient, which is great when you need to fly thousands of miles without stopping to rest, but slightly terrifying when you're trying to understand how inhaled anesthetics behave. Many birds are anesthetized with masks because placing an IV in a parrot's wing while it's trying to bite off your fingers can be challenging. Another thing is that their high metabolic rates mean that they can become hypothermic really quickly. A small parrot under anesthesia is losing heat at an incredible pace. Veterinary teams often use warming blankets aggressively because maintaining temperature is critical. And of course, many birds are prey animals. They instinctively hide weakness and stress. So by the time they actually look sick, they're probably already in serious trouble. Okay, now we get to the really weird stuff, snakes. First of all, snakes only have one functional lung in many species. Second, they are ectotherms, which means their body temperature depends on the environment, and that creates a difficult anesthetic problem. Their metabolism changes dramatically with temperature. Cold snake equals slow metabolism, and hot snake equals fast metabolism, which means the anesthesia can behave completely differently depending on the temperature of the room. Imagine if a human patient processed medications twice as slowly because somebody turned down the thermostat in the operating room. That's a real consideration in reptile medicine. Breathing can also be tricky because reptiles often tolerate very high carbon dioxide levels compared with mammals. Their physiology just follows different rules. And if you think intubating humans might be stressful, imagine intubating an enormous python that would really prefer if you didn't. That takes a special kind of confidence. Now let's talk about the most beloved giant rodent on Earth, the capybara. Capybaras are adorable because they're incredibly social animals. But they can become stressed when they're separated from their groups. And stress matters enormously in anesthesia. A calm patient is generally a safer patient. A terrified patient's body can launch a massive stress response, causing problems before the anesthesia even begins. Adrenaline surges through the bloodstream and heart rate goes up, blood pressure rises, oxygen consumption increases, and metabolism shifts into full fight or flight mode. Capybaras also spend a lot of time in water, which means dealing with them in the operating room comes with some unique considerations compared with traditional pets or livestock. And honestly, I just love the idea that somewhere in the world, a veterinary anesthesiologist wakes up in the morning and thinks, okay, today I have 3 capybaras on the schedule. That's a level of professional variety that most of us can only dream about. Now that we've talked about animals that might come to you, let's talk about animals that require house calls. Zoo anesthesia is where things get really crazy, because step 1 is often figuring out how to get close enough to anesthetize the animal without becoming lunch. Firing anesthetic darts from a rifle is a huge component of wildlife and zoo medicine. The anesthetic has to work reliably, but not so fast that the animal injures itself during induction. The team has to consider where the animal is likely to fall. They have to consider whether it might enter a pool of water and potentially drown. They have to consider how quickly they can safely approach. But once the animal is asleep, the rest of the principles start looking a lot more familiar. Airway intubation, monitoring, temperature control, and pain management. But the stakes are undeniably higher with wild or zoo animal care. Anesthetizing a 200-kilogram tiger requires some pretty precise planning and teamwork. And then there are animals like aardvarks that have some specialized physiology, some unusual anatomy, and almost no anesthesia research compared with more common animals. Sometimes veterinary specialists are essentially combining scientific evidence with years of practical experience to figure out the safest approach. It's part medicine and part detective work. What I find most impressive about veterinary anesthesia is the amount of knowledge required. Human anesthesiologists spend our entire careers just on one species. Veterinary anesthesiologists have to learn about dozens. They understand birds, reptiles, mammals, exotic pets, zoo animals, and even livestock, each with unique anatomy, physiology, pharmacology, and unique personalities too. At the end of the day, the mission is exactly the same as in human medicine. Keep patients safe, support physiology, control pain, and help them wake up comfortably when it's all over. Whether that patient is a golden retriever, a macaw, a python, a capybara, or a tiger, the principles of anesthesia remain remarkably universal. But the details really are where things become wonderfully weird. And honestly, I think that makes veterinary anesthesia one of the coolest fields in all of medicine. If you liked this video about animal anesthesia, let me know in the comments and I'll make a part 2. Thanks for watching, and I'll see you in the next one.